I'll be your student nurse today. Please tell me your name and date of birth.
Grace Pepperman, April 4th, 2003.
Can I check your wristband? All right, this is the correct patient. So today I'm going to be doing a focus assessment on you, which should only take 5 to 8 minutes. I'll try to explain as I go along, but feel free to stop me if you have any questions or experience any discomfort. Do you understand what we're going to be doing today?
Yes.
Patient understands the purpose of the assessment? Okay, so before we get started, I'm going to ask you to empty your bladder. Patient has emptied her bladder, and I'm going to hand you this gown. It ties in the back. All right, in respect to warmth and privacy, are you comfortable in this room?
I'm comfortable.
Okay, patient states that she is comfortable. Okay, so as I'm standing here, I'm going to go ahead and ask you some questions before we get started. Do you have any chronic illnesses such as diabetes, high blood pressure, or kidney failure?
No.
Okay. Do you have any chest pain, shortness of breath, or palpitations?
No.
Okay. Do you have any swelling, pain, or skin changes such as redness, warmth, or visible veins in your legs?
No.
Okay. Do you have any family history of diabetes, high blood pressure, cardiovascular disease?
No.
Okay. Patient stated no to all these, but a patient would have stated yes. I would have assessed with old cards ice and techniques for special circumstances. Okay, so I'm going to keep going by looking at the patient's general appearance. The patient looks clean. She looks at ease. Her breathing is non-labored, and she just looks like she's in a good mood, and there's nothing obviously wrong. Okay, so next I'm going to go ahead and feel your head and neck pulses to make sure that you're getting adequate blood flow to these areas. All right, so I'm going to check your temporal pulses. All right, temporal pulses are equal and easily palpable. I'm going to go ahead and check your carotid on each side, just one at a time. All right. Okay, carotid pulses are equal, or regular and easily palpable. Okay, so I'm going to go ahead and assess your arms. Okay, patient's arms are proportional to her body. The skin color is tan and appropriate for ethnicity. Her temperature is warm. And go ahead and check your hands. Okay. Patient's capillary refill is brisk, less than 3 seconds. The nail is pink and the nail bed is 160 degrees. I'm going to go ahead and check her skin turgor. Okay, patient's skin is elastic and no tinting. So now I'm going to go ahead and check your pulses while I'm here. Please just relax your arms. Thank you. All right. Patient's pulses are equal patient's brachial pulses are equal bilaterally and +2. Patient's radial pulses are equal and +2. Okay, so now I'm going to go ahead and move on to your legs. Patient's legs are proportional to her body. She is a nice color that's along with the rest of her body. It's appropriate for ethnicity. She's a nice tan color. Her temperature is warm throughout her legs. I'm going to go ahead and check her pedal tibialis pulse. This is equal and +2. Her dorsalis pedialis pulse is equal and +2. All right, great. So I'm going to go ahead and assess the patient's chest. Please just breathe normally for me. All right. Patient's chest is symmetrical and proportional to her body. There are no abnormal pulsations. I'm going to go ahead and look at your apical pulse. Patient's apical pulse is in the mid-clavicular line of her left clavicle. It's going to be 5 intercostal spaces down, so right underneath her breast tissue. And I'm going to go ahead and listen to that for a full minute and assess the regularity as well as the pulse rate. All right, if you wouldn't mind lifting your shirt up for me, just enough to where I can get to this spot right here. Great, thank you. This is going to be a little cold. All right, here we go. All right, you can lower your shirt. Okay, patient's apical pulse. I assessed that for a minute and the apical pulse was 65 and the beat was regular. Okay, so next I'm going to go ahead and listen to the rest of your heart sounds. I'll be doing 1, 2, 3, 4, 5, and then I'll assess as well if those are regular. All right, here we go. Okay, I'm going to reach inside your shirt. Okay, going to reach a little lower. Okay, I'm going to go from the bottom. Thank you. All right, one more. Okay, lower your shirt, thank you. All right, S2 is louder than S1 at the aortic and pulmonic valves. S1 and S2 sound equal at Erb's point. S1 is louder than S2 over the tricuspid and mitral valve, and there are no murmurs present. Okay, I believe this concludes our perfusion assessment.